Good evening, everybody. I am Dipanjan Ghosh. Today, I wanna discuss our need-based discussions of your chapter breathing and respiration. So, I want to discuss for those students who have taken preparations for NEET and GenPass, which questions basically very important and come to the consecutive examinations of Medicaid and which questions on which terminology all of you should have to emphasize. I have just wanted to discuss. So all of you focus to my discussions. So first of all, the one question is that is the respiratory organs in animals. So you have to look forward. So different animals, just as Protozoa, Amoeba, Eugenia, Paramecium. How do they perform their respiration? But they have performed it by cell membrane. And in case of Annelida or Arthropoda or Mollusca, in case of Annelida, we know Arthroam or Urinaria, they have done it by skin, whereas Piraceae and Trachea used by cockroach or geese or accessory respiratory organs or buckyung. Or in case of young, we know basically the amphibia, reptilia, aves, and mammalia, they use youngs for their respiration process. Okay, and now I come to the common respiratory process of man, that is the respiratory system, nostril and nasal passage, that is from external and internal nostril to pharynx to larynx to trachea to bronchus to bronchio to young. But all of you have to give emphasis on that larynx portions, because different cartilages of larynx, there are 9 cartilages. The number is 9. And if we see the number of, if we see the cartilages, then we can find out thyroid cartilage will remain 1, cricoid cartilage 1, arytenoid cartilage 2, cuneiform cartilage 2, cornicuate cartilage 2, and epiglottis 1. So 1 plus 1 plus 2 plus 2 plus 2 plus 1, that is 9. 9 cartilages presents to the larynx. But beside within that cartilage, all of you have to focus on the thyroid cartilage. This is the large cartilage among all. Okay, and larynx is also called the voice box. Okay, because the voice is actually generated here, and you have to give emphasis on the structure, that is the hyoid bone to thyroid membrane to thyroid notch, then the thyroid cartilage, and after that consecutive way the cricoid cartilage and the another cartilage are also present. So you have to keep remember it. And Adam's apple, all of you know, the thyroid cartilage have made an angle with the larynx, and in case of May, that bulge portions is known as the Adam's apple. Okay. And now I come to the hyoid bone is very essential, already I have mentioned. Then different muscles will come out, that is the external intercostal muscles or the sternocleidomastoid, scaeni, anterior serrati or elevators or scapula. Okay. Now you have to emphasize on the O2 dissociation curve. That is when hemoglobin we bind with oxygens, and what are the conditions which we favor to the binding state of hemoglobin with oxygens, and the relations of hemoglobin oxygen dissociation with the alterations of the partial pressure of oxygens. Whenever the partial pressure of oxygens will be 40 mm, then how much amount of oxygens will be attached to its hemoglobin. So you have to look forward towards the sigmoid Cepheid curve. And factors affecting O2HB dissociation curve, that is partial pressure of oxygen, temperature, pH, that is the hydrogen ion concentrations, 2,3 BPG, and PCO2, and with the attainment and with the increase or decrease of that factors, how do the oxygen dissociation curve is actually influenced. Okay, and then the chloride shift or Hamburger process, this is very important, and reverse chloride shift is also important here. Okay, so you have to focus on that. And Bohr effect and Hayden effect, whenever the partial pressure of oxygens will be more than partial pressure of carbon dioxide, then it will facilitate that it will helps the binding of hemoglobin with oxygens, and whenever the PCO2 will be greater than PO2, that is the partial pressure of oxygens, then there will be more affinity of carbon dioxide to binding with O2 by binding with hemoglobin rather than oxygen. So one is Bohr effect, other is Hayden effect. Okay, so you have to keep remember. And besides it, Kane-Stokes breathing. Caisson's disease. Caisson disease is nothing. Whenever the man will go to the deep sea, then due to the more pressure, the water bubbles will enter to the vein of man, and that can lead to the death of a particular man. So such disease, such intravenous bubble incorporations is known as the Caisson's. That can lead to the Caisson's disease. Okay. And the regulation of respiratory center is very essential. All of you know the pons and media are basically responsible for the control of respiration. So because pons contain the amniotic center, okay, and different inspiratory and expiratory center also present here. And you have to remember the dorsal respiratory group of nuclei, the ventral respiratory group of nuclei. That portion is very essential. What is reticular activating system? How do the reticular activating systems charge? What is nucleus tractor site areas? You have to give emphasis on that portions. And two types of reflex are also important here. One is Hering-Breuer reflex. That reflex is very important because you have to keep remember, one is vagus nerve, that is the 10th cranial nerve, which is parasympathetic in nature and which is associated with the Hering-Breuer reflex, and that vagus will do its act by the help of phrenic nerve. Okay, that denotes the cessations of inspirations and start of the expirations. And the another reflex is the sino-aortic reflex, because that reflex is actually done by sino-aortic nerve. And you have to give emphasis on aortic body and carotid body, and how do they do their functions with the alterations of PCO2, that is the partial pressure of carbon dioxide, or the alterations of carbon dioxide concentration, that is the chemical changes altered there. Because you know there are different types of receptor presence who are the chemoreceptor presence, that is the carotid body and aortic body. They can sense the alterations of carbon dioxide to the blood, and whenever the carbon dioxide level will be elevated, that will ultimately lead to the elevations of the hydrogen ion concentrations. Whenever the H+ concentrations will be elevated, then the pH will be declined, and then they can sense, and by the nervous regulation process they will balance the respiratory rate. Okay, so you have to keep remember. And there besides it, there are different respiratory volume also, such as tie-dye volume, that is the normal inspiration expressions, amount is 500 ml. The inspiratory capacity means the tie-dye volumes plus inspiratory reserve volume. The expiratory capacity, that is the tie-dye volume plus expiratory reserve volume. The vital capacity, that is the tie-dye volume plus inspiratory reserve volume plus expiratory reserve volume. And the total ion capacity. Whenever the residual volume will be attached to it VC, then it will be denoted as the total ion capacity. And you have to remember the anatomical dead phase and the alveolar dead phase. Anatomical dead phase and the alveolar dead phase, two terminology is very much important. And the different disorder, respiratory distress syndrome associated with respiration, such as asthma, that is the airway resistance, and the emphysema, whenever due to excessive smoking, the inflammations of the pleura is actually occur. That is the emphysema or the hypoxic conditions, whenever the oxygen deficiency of tissue occur, or the apnea, dyspnea, mountain sickness, acclimatization. So these terminology are very much important. So all of you, I think, look forward. We keep remember your concentrations, in which terminology I have emphasized, and all of you should have to carefully enough whenever we read that particular chapter and that particular portions, and you should have to grow up a good clear concept of that particular portions, because that portions is very, very important for your NEET medical exam and Gen Pass. Thank you.